Yesterday, we had a business with the skills that we learned, but we couldn't actually complete them. So today we had a spillover of that. Would have it done today, and would have the first aid skills. So far, so good. We've been talking about from the first module to the end, like I told you when we started, that everything it rubs on each other. That is, there's no part of it that stands on its own. Each module encompasses communication. Each module has to do with infection control. It just mixes up like that. So today we are going to learn how we can attend to casualties or to our patients or to our clients, because one thing that is very important is the fact that as a caregiver, you must have first aid skills. Like, I cannot overemphasize that fact. You must have first aid skills. Not only as a caregiver, I advise everyone, even if you are not in the health sector, try to have the basic knowledge of first aid. If this happens, what do I do? This happens, because there can be so much confusion when something happens and there's just nobody that has the right knowledge to know what to do. That's actually cost people a lot of lives, gone. So today we want to just quickly see what we have to do. So it's nice to see Sylvia here, and Joy. Joy, it's nice to have you. Jovita, Charity, Excel. Today is our last day, so I am just taking my time to ensure that I at least speak to every one. So to be sure that I have cut across everybody, because after today, the next interface we are going to have is going to be our professional examination. So today it's always a very beautiful day for me, the last days of my training, because I get to interact with my participants more. So thank you for being here. Are we together? Hello, Joy.
Yes, ma. Good morning, ma.
Good morning. Trust you had a beautiful night rest.
Yes, ma.
Okay. Thank you for being here. Jovita. Hello, Jovita. I had already spoken with Mr. Kingsley because he came here on time. So Jovita, hello, Jovita. Are you good? Okay. Miriam, it's nice to have you here. And
Yes,
Charity, Excel.
yes,
okay, while we wait for other people to join us, I think we just need to continue from where we stopped. Today, we're going to have practicals, but before we go into the practicals, we would have a brief session. We would like to talk about just a few things that we need to know in the next 40 minutes to say 50 minutes. We'd look at some of the slides. So at this point, let me just share my screen and let's get down to what we have. Okay. Okay, yesterday we looked at self-care for caregivers. Please, can everyone see my screen? I was trying to share. Can we all see my screen?
Yes,
Yes,
ma.
yes, ma, I can see it from here.
So I'm going to just put it in slideshow so it's easier for us. Okay, let's we talked about how a caregiver can take care of himself or herself, understanding that in as much as you want to render care and service to another person, to help the wounded, to help the sick, to help the vulnerable, it is equally very important that you look out for your welfare. You are able to handle stress. you are able to handle whatever comes your way, because of course, we are going to have such situations. So again, I want to say, because over time, having these trainings, I've had feedbacks. That's why I like to hear feedbacks from you as well. One at a time, or at one point, someone asked me a question and said, okay, you know, as men, we are not expected to show our emotions. You know, sometimes it bothers me. I'll feel like crying, you know, maybe expressing the grief. But I just feel that if I express the grief, maybe people would, I'll be looked at, you know, because men normally, as we already know, they are already not used to showing emotions like that, like the women folk. But the question I asked him was, okay, how did you feel? He said when he lost someone that he was actually taking care of, someone that was very dear to him, that it affected him. And most times he felt like crying, he felt like letting it go. But the fact of being considered weak made him not to do that. That maybe they will see that he's weak. And, you know, so why am I bringing this illustration? Even as men, it is important that we should try. You're letting out emotions. You're maybe crying. You're being sober. It doesn't in any way attack your virility as men. It doesn't. I just felt I should bring that. I just remember that right now. So at any point you are doing any caregiving work, it is normal and okay for you to let it go. You can let out the tears. You can look for ways to be able to continue with the grief and so on and so forth, like we did yesterday. We don't intend to go back and really delve into it. So today, practically and quickly, we want to look at first aid skills, CPR and first aid. CPR and first aid. Now, like I said, that CPR is very, very important. What do we mean by CPR? We are going to get to see it as we progress. Now, CPR is important because at times you need to actually spring into action when there is an emergency. As a caregiver, you can have emergencies at any time because you deal with vulnerable people. You deal with people that are actually, that anything can happen. Permit me to say that. So it is very important that as caregivers, we should know our onions. Like we should have it as an added. That's why I advise people, try to get a CPR certification, try to get a basic life support certification, or wherever, just ensure that you equip yourself with these things so that if you come face to face with an emergency, you know exactly what you're expected to do. So now I don't know about the quality. I always like to share this video because it will help us to see that there is a thin line, very thin line between life and death, very thin line. And so if we understand that there's a very thin line between life and death, then we need to learn all the skills that we need to learn. Because if an emergency happens now and we are not able to arrest it, especially from this part of the world that we are now, that I am now, it's a difficult thing because before you call for help, before help actually comes to you, more harm is done. So why don't you learn the things you need to do to help to keep the person holding the threat of life before the paramedics arrive, before the actual medical practitioners arrive? Because as a caregiver, you are restricted, your duties are restricted. What I want us to understand. So now, quickly, as fast as possible, let's take a look at this video. Let's just look at it, and then we can discuss it thereafter. So to find out if we can. The thing is, maybe the can we hear anything?
Yes, I can see it.
Okay, I'm talking about the volume. Can you hear you? Can you hear anything?
No, the sound.
Let me see if I'm a co-host. I need to do something. Please let's mute our mic so that today we'll just move. Today, I assure you, would not take the 4 hours. We'll be done with this in no time. can assure you. So let's help ourselves. So I'm going to play the video again, and I'll need you to tell me if you can actually hear, if you can hear anything. Please, can we hear anything?
No, ma, I can't hear anything.
No, ma.
No, ma.
No,
yeah.
ma.
All right, no worries, no worries. Just give me a sec. Let's see what's yes. Okay, we are getting back to the video. Just watch, relax and watch.
Can you help me call the ambulance?
Everyone's right away in the business district, please. Yes, someone has just collapsed.
Can you get an AD, please?
Excuse me. Wait. Excuse me, sorry, excuse me.
Begin by removing all clothing from the patient's chest. Feel one place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient.
Okay, guys, stand clear, guys.
Analyzing. Shock advised. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
Sir, you okay?
What happened?
We found him collapsed, so we did CPR, and I gave him one shot from the AED. Now it's
Okay. We'll take over.
Okay, so I don't know. Were we able to get anything from that?
Marie, you will be fine.
able
We
to
will send
see
you
at
to the
least-
nearest hospital.
Hello?
Just a
Are we
bit of
together?
the audio. I could only get just a bit of the audio.
Oh.
In this video, I'm going to demonstrate how to
Okay, you could only get a bit of the audio. And I don't know What about the others? Please, can we, I don't know if we got see the video. Please respond so I will know.
Chair on a different program.
Hello, are we together?
Yes,
Everyone
madam.
is
Yes,
just
Maria, together.
okay, please. Just couldn't hear anybody. So I was asking if we were able to watch that particular video, if we understood anything from it. And I would like us to say if you actually were able to watch it, just one sentence, maybe in one sentence, something you saw or something you observed or something you learned from it so that we can move. Because I don't know.
Hello, ma.
Hello. Yes, yes,
Joy
please.
that is talking.
Okay, Joy. Joy, thank you. I want to get a voice, Joy. Go ahead.
I observed that before he started doing the CPR, he advised the people that were standing around the patient to move back so that the patient won't suffocate because the patient needs air for the CPR to work.
Thank you so much. Beautiful. So that means you were actually able to see the video. At least I'm happy because I thought people could not.
I'm just joining. Sorry, can CPR be
Because-
repeated? I'm just joining.
Right.
Sorry. Please, can CPR be repeated? I'm just joining. Network has been.
Pardon?
I'm just joining. I don't know that CPR can be repeated. My network has been so bad. I'm struggling to join. I just joined now.
We just started. We just started, and this is actually the first slide at the top that I just finished saying. So I know others joined for you. Others joined. So I was trying to ask. I want to know if we were able to watch the video. Okay, let me ask Miriam. Miriam, were you able to see anything? Hello, Miriam.
The
Miriam,
network is also
able to see
disturbing
anything?
from my end.
Oh, wow.
Because
Okay, because you know what I
able
do?
To just leave.
Your network is not very good. That's all. Okay, Mr. Kingsley, let me ask the people I know would respond. Mr. Kingsley, please, were you able to get something from that?
Actually, I just heard a bit of the audio and some parts of the video, but what I noticed really clearly was he unbuttoned his shirt and asked them to move back. Then he applied a shock machine to his the right side of his chest and activated it to resuscitate him.
Okay, thank you so much, Mr. Kingsley. I know you are always on. Okay, let me ask Madam Kusan.
Hello, ma.
Is she here? Yes, Madam Kusan.
Yes, ma'am.
Were you able to see anything?
Okay, yes. So for what I observed, when the person was trying to resuscitate the other, the person that was on, I think the person choked or something. And then the first aid that was given before calling 911. I wasn't too sure what he was actually trying to achieve, whether he was trying to clear the airways of the person as in thereby providing, but I think it's something that it will have to be a professional to do that. So I'm suspecting that the person must be either a doctor or a trained or trained in first aid to be able to provide that first aid that was given to him before the the medics arrived. So that was what I really observed, and then it was like going on the freeze a bit and come back. So that was what I picked up from it.
Thank you so much. Thank you, Madam Susan, for that. So you just said it. That's what actually happened. I just had to find out if a couple were able to see it. So that this is actually the first part of the training. That's the first slide, rather, of the training. We just started not too long. So practically what happened is, when it comes to cardiac arrest, like today we are going to do a little bit think that is small statistic that in every day we have about a very good number of people that either slum here, maybe in slum on slum out, slum here, and slum there. So that's why it's very important for us to like have that knowledge. That's give us. May have such a situation. It may not only be maybe in your sector, the caregiver, maybe maybe even outside. But for the mere fact that you have the CPR knowledge, you know what to do and spring into action immediately. That particular machine, like I said, that this program has you have to learn other things as well. We just have to add it because we want you to be well-grounded, to have all the knowledge that you need to use when the need arises. So there's what we call an AED. That was actually the machine that was used. It's called an AED. That is an automatic external defibrillator. That is what it is called. It is actually a machine that is used to shock the heart, to restore the blood circulation and flow to the muscles of the heart. That is an AED. You see that we have some trainings you get to see online, say CPR, AED, and first aid. So whenever you see that AED, know that they want to teach the techniques that are how to operate that automatic external defibrillator. And of course, if you watch that video very well, you see that when there is an emergency, people should move away, because what actually happens, say for instance, maybe there's an accident on the road, or something happens on the road and you run into an accident, you see an accident scene on the road, you see what happens. You see people just come from nowhere, right from the back center, they'll crowd around the person. They are saying they are of no use to that person because they don't have the right knowledge, they don't know what to do. So that is why they said that even the best doctor is not as important as a person has particular knowledge of first and can use it at that instance before the arrival of the medical practitioner. That is very, very important if you look at the video. So there's a very thin line between life and death. And so when things happen, you have to act fast, especially cardiac arrest does not give any time. So let's look again at this one. This is yet another video. We are going to have 3 videos in this training, and I just pray that God will help. Just don't think it will take also, and after that we can switch to the actual practical and see how it is done. So this is yet another video. Let's see. I'll have to ask you, you can hear the volume. We want to look at how to use the AED. It's an added knowledge for you as a caregiver. You just need to know it. I thought it should be there. It's one of the things that you need to know. So let's just delve into it. See it to find out if it is. Okay, maybe. Share audio. Let's see what's actually happening. Maybe we just have to leave these videos.
A defibrillator. By this stage, you would have started CPR already. Once the defib arrives, in this video, I'm going to demonstrate how to use a defibrillator. By this stage, you would have started CPR already. Once the defib arrives, you're going to turn it on and you're going to follow the prompts. The defib will give you really easy and clear instructions of what to do.
Remove all clothing from patient's chest. Pull red handle to reveal pads.
Now it's time to place the pads onto the person's bare chest.
Apply pads to bare skin exactly as shown in the pictures. Press pads firmly.
At this point, the defibrillator will start analysing the person's heart rhythm.
Analysing heart rhythm.
The defib will advise us to stand clear, and it will advise a shock is being delivered. Step back from the patient and keep your hands in the air. That way, we're letting any bystanders know, do not touch.
Delivering shock. Shock.
Okay, I think what we should do is you get to have the video in the slides so that because also we are having network
delivered.
If a shock was not successful, we need to continue with CPR.
I don't know what you think. What do you think? And let's keep the video and then get to have it so you can time and because I think
it's better.
Don't have the same. So we don't have that same issue of the first. So let's just move so that we can save time. So practically, we are talking about a cardiopulmonary resuscitation. What do we mean by CPR? Cardiopulmonary resuscitation. Cardio means the heart. Pulmonary refers to the lungs, like we can already see here. Life-saving technique that is useful in many emergencies, including heart attack, and cardiac arrest as well. So it's also very important that we understand there's a difference between heart attack and cardiac arrest. Up until now, people used to get it twisted. You think they are the same thing. No, they're not. Someone is saying network is bad. Oh, wow. Okay. Can everybody hear me, please?
Network is cracking. Your voice is a little.
My network is fine, so I don't. Please, I need to hear everybody unanimously. Are we together?
Your very bad. Your voice is.
Yes,
network
is very, very bad. Even the video
I'm just trying to hear. I've not really been following up because sometimes it's really lovely out.
So what's actually the challenge? Because my network is okay right here.
My MTN network has been terrible and it gets more terrible by the hour. It's terrible. Anybody using MTN, it's terrible.
I'm actually using Airtel network because I have MTN, but I have changed to Airtel because of the MTN challenges. So if you are using MTN, it's advisable. If you have an Airtel SIM, it's advisable you do that. Because what I really do when I have trainings is I have 2 persons that actually join meetings with their phones. So they are able to
also, I will advise people to unmute their microphone. Unmute your microphone. Unmute your microphone so they can hear.
Okay. Unmute. Oh, you mean, are you advising me or you are the other participants?
Mute, rather. Mute.
Okay. So my microphone it's on mute. Everybody can hear. So depends on the network, but let me try. Okay, I was talking about cardiopulmonary resuscitation, and I was saying that anything cardio refers to the heart, and then pulmonary refers to the lungs. That's one thing we should understand. So CR is life-saving technique that is very useful in any emergency situation. It's very, very important that everybody in the health sector to have basic knowledge and able to carry out CPR, cardiopulmonary resuscitation. So I don't know if that's better. Can everybody hear me? At least I'm trying to speak out louder. Can everybody hear me? Is it better?
Yes,
Yes,
ma'am.
yes, ma'am.
Okay, I'm trying to really speak out. So be with my mic. I hope that everyone would just try to hear me. It's so sad that the training is coming at this point where we have a set and we have some issues. So it's usually not like I apologize. I apologize for this on the network. So I was saying it's important that we get trained in first aid. We get trained in how to do CPR, to give the chest compressions and to give the rescue breath. Very, very important. It can save a life. So let's go to our next slide because we wouldn't want to exhaust all the time. Today is a Saturday. Now, CPR can oxygenate blood flow into the brain. The essence of actually having CPR before the arrival of paramedics. For instance, someone slumps, maybe clutching the chest, like we had that video, just hold on to the chest and then slump. First thing to do, following the technique that you learn today when we go practical, as you see the practicals, the aspect of it, you check, you find out if all the body, everything is in order, and then you switch into action to give CPR, because when you carry out that CPR, you are helping the oxygenated blood flow to the brain, to the person's brain, and other vital organs will begin to function because of that process of CPR that you are carrying out. So when the heart stops originally, there is lack of oxygenated blood. The heart cannot just stop with a problem. So if there is lack of that blood, that oxygenated blood that we need, it can cause brain damage in only a few, it doesn't even take a long time. It can cause brain damage. So a person may die within 8 to 10 minutes if you don't carry out CPR on a person that slumps, maybe a person that has cardiac arrest or a person that has failure. That is why this is very, very important for us to learn. And the rate at which we have people actually die as a result of maybe slumming in the church or in the market or somewhere, we need to take this very seriously. Now, what is the CPR? It combines the rescue breathing, with the resuscitation itself, with the chest compressions, the rescue breath, and the chest compressions. Now, when do you have CPR? Not just like I saw people just CPR anyhow. You only can carry CPR when there's no breathing, when the person is not breathing or has a weak pulse. Maybe doesn't have pulse. Like we talked about areas of a pulse points in bodies. So can you find that when a person is not does not have pulse, because you just check for the femoral or brachial, you check for the areas with pulse. You find out if that person is still conscious or not. I think we are going to see how about it. So the body, especially the our brain, the oxygen, the cells are alive. So the air we breathe contains oxygen. We breathe in and we breathe out. We breathe oxygen out, send out. So we can save life if it is blown into the casualty's lungs. That is why you can help with the artificial air by giving the rescue chest compression. So if the pulse is absent, artificial ventilation must be combined with chest compressions. Otherwise, oxygen will not reach body vital signs that we need, all the things that is the places that need the oxygen. If you do the CPR, the person cannot. So that's why CPR is very important. Now, I'm just going to have it, so I will not really delve on it. These slides are going to be for you. I try to make it to prepare them for anything you need to know about first, at least basic ones. You are going to put them in the slides. So we'll just run through. You know, beside the casualty, like you are going to see, when practicalize, you put the chest compressions, you give the breath, and then you do what you have to do and do it at the nick of time to be able to save that person. Mouth-to-mouth ventilation too. Now, the capacity lying flat can remove any obstruction, including broken pieces or dentures. You can do a lot of things. We'll see it when we do the practice. Practicalize it now. you can blow into the casualty's mouth. Like I said, there's one reservation concerning that to use the mouth to mouth, you know, maybe you may not want to actually go like that. So we have a very thin sheaf or something. We have a particular material that could be used to place. Just place is very get to show you. I think I have it in the first aid book. So you can use that one if directly you don't do. I've had questions asked. Has even in the community say, if maybe I run into an accident and the person that is there lying down is a man. This is on a lighter note, and I'm a woman. How will I do the rescue breath? And I had to start to laugh because when human life is concerned, when a person is hanging on the thread of life, you don't consider some things, like you don't go that route. So someone just asked me what I should do. So the most important, like we said, care paramount. What is paramount to use to save human life? It takes how it takes. You just have to save the person's life when it arises. If you are trained in first aid, not only do your caregiving duty, even when you are outside, anywhere, any emergency can happen, put into action. Why you will have that because you are trained, because you already know that's why this training you know, you already know. So in the condition where you see people crowd around, people crying, holding off, all you need to do is to spring into action. Have the people give ventilation and spring and be what to do. And don't forget that as first aiders, we cannot first aid and caregivers as well. We cannot cross certain limits. Not expect to give drugs or do anything. One is just to perform first aid at that point that the person needs it. So before the arrival of the paramedics and before you attempt to do CPR on anyone, ensure that you place a call for you place a call, maybe 911, maybe 211, depending on the numbers, the emergency numbers that we have, so that in the process, as you are trying to keep that person alive, doing what you know how to do best, you are rest assured that paramedics are coming because you are not actually a doctor. So you can only just only just render first aid. So now these are some things that we need to. We have AVPU, we have AVPUs, acronym that we are going to have to look at. A is for alert, P is for voice, responsive, pain, responsive, and unresponsive. These are acronyms. So check that person alert is number one. You need to find out if the person is actually alert, like to see any signs of the person being alert. And then you share the person, voice, hello, are you okay? What is the challenge? But the person that is will say, or the person will want sound of the other, you'll be able to. That's why it's important that the healthcare practitioner, you have to be sensitive and have to be alert, you know, observe, very, very observant. So if you carry out the blueprint, you touch, maybe touch and feel, touch the person, touch it, you will know it's actually feeling the. You understand? And you press the hand, the person, or do something to a sign. No, that's it. And if finally you do all those things, the person is not responding, you know that an unresponsive situation. That is that to get to see when we progress. Okay, so I don't know, are we okay? Are we that? Can you hear me? Is the network better?
Yes, I'm following.
I can hear, but it's cracking. Network is cracking.
But you can't see.
Please, ma, the network is cracking. Good morning, ma. Cracking, I can't hear it.
It is well. It is well. It's very, very, very well. Please, if people can see my screen and hear me, if you can hear me, please just shout. Let me hear. Know that you can hear me.
I can hear you and I can see your screen.
The voice
that
is a little bit. Your voice is a little bit cracky.
Okay, so if my voice is cracking, obviously it is as a result of network, because I am actually hearing myself. And thank God for the one or two people can hear me. Is it okay that she can hear? Good. So we can hear our devices connected around. We can, the people can hear. To me, it's a network challenge. However, don't worry. Like I have said, you get to get the slides. And at any point, if you're confused, at any point, go through the slides. You have any issue at all or any challenge, please drop in the register. That's why we have that group. Even if it is in the midnight, you are going through the slides, you have any issue you don't understand, please just reach out to me. The caregiver is like a doctor. Anytime anyone can call you. So please do, in case you don't be able to hear some of those things. We are fine over here. So now to open airways, there are things you do. You tilt the chin, you lift, and so on and so forth that we have on the fingers, the other hand, that bony part of the jaw. As you can see, I took time to ensure that you have pictures, elaborate the write-up so that you'll be able to understand at point what each sentence talks about. But if you suspect neck injury, that's what you have to be careful. If you suspect that a casualty has a neck injury, please stop still. Just, do not move the victim's head. Sorry, I beg your pardon. Not move the victim's head. Lift the chin without tilting the head back because of the challenge, because of neck. You know, people have, your clients may be someone that maybe has injury or has problem. You cannot proceed to tilt the jaw and do every other thing. No, you have to be careful when this thing. So let's see what we have on the next slide. Please remember, if you have any questions, I have put through the chat box. Today, I want it to be seamless for us, and I know that today is the weekend. You may want to just go back and rest. So I can assure you, we'll done in no time. We don't exhaust that 4 hours for today. But we'll complete judiciously everything we have to do. So unconscious casualty airway may become narrowed or blocked when someone is unconscious, and this makes breathing difficult. It makes breathing difficult. And the main reason for this is that the muscular control is lost, which allows the tongue to fall back and block the airway. There's nothing as bad as airways of a person being blocked. You know what that means? That's you moving over onto the other side. So lifting the chin until the head back lifts the tongue away from the entrance of the air passage, allowing the person to breathe. That is why you have to tilt. That's the importance of tilting, so that you can lift you can clear the airway for free air. Now, to check breathing, you place your ear down, like you can see there. You have the visuals very, very well explained. So you place your ear over the victim's mouth and then while keeping the airways clean. Look at the victim's chest, because when you do that, if it's for someone that is conscious, see the rising and the falling of the chest, that tells you that the person is breathing. Okay, to check circulation, head tilt. Then locate Adam's apple, all of us know, like you have seen there, pulse. Locate the Adam's apple, you are going to see, you find out carotid arteries there. So find out if you can feel any pulse. Then you know that yes, that person is still has life in, or has in her. So this is another video too, I guess. But I am thinking, okay, it's not a video, it's just about what is an external, automated external defibrillator, like I told you. This machine is very, very important. It's quite expensive, so it's not advised that well, I don't not advise for people to really have these organizations that have it in strategic places, so that when the research like we had, everybody knows immediately they get it, because the AED, what it does, shocks the heart, especially when yes, please go ahead. I can hear you, please. Can everyone hear me?
Yes, ma'am.
Okay, I thought someone wanted to ask a question. Okay, let's continue. So this is an automated external defibrillator. And it is a machine, like I said, that is used to shock the heart, for electrical movement to function. Like I tried to tell you, when there is a sudden stop in the functioning of electrical rhythm in our heart has electricity. It should not shock you. Our heart has, just the way we operate our NEPA light and every other, the electrical channels in our heart. So when there is any malfunction of the electrical rhythm of your heart, immediately results in loss of consciousness, which gets you into cardiac arrest. So that is why an external defibrillator is very, very important. Most organizations have it, and it's advised that you have it in case of an emergency. You support it with your CPR as you attend in casualties. So we have the head to examination, which involves you using your hands to feel the parts of the body of the person, like you feel, you touch, head to toe examination to be sure the spinal cord, to touch and see if there's any pain. Where is the pain coming from? You understand? Because in cases where there is accident or there is an emergency, there's a lot of confusion. People don't really know what to do. Go to the left, the right, and there's confusion. So if you know what to do, first you need to get to that scene, you follow the normal as we are going to do, and you know exactly what you have to do when you get to such situations. So like now on this slide, we have the difference. As you can see it there. I guess everybody can see it. As slides for first aid is very rich. That gives you a step, whether you hear what I'm saying or you don't hear what I'm saying, it gives you a detailed and step-by-step to these things. I might in case actually hearing me. So at this point, I don't know if we have any questions, so we have anything to ask or contribute from people that know very valuable professionals on the platform. Do we have a question or do we have any contribution at this moment before I proceed quickly?
Okay, this is Kingsley speaking. About the defibrillator, I think there's one I witnessed during a football match. People who watch football might be familiar with this story. There's a man called Erickson. He plays football, so he collapsed on the field. So they resuscitated him, and they now had to place an internal defibrillator in his heart. So anytime his heart stops, it restarts it. So, but I don't know what that looks like. I don't know if you have an idea about that. Hello? Hello?
I'm with you. I'm with you. Can you ask that question again? I couldn't hear you very well.
Okay, it's not actually a question. I said, speaking on this external defibrillator, there's an incident that happened during a football match. A player collapsed, and they had to resuscitate him. But he now lives with an internal defibrillator, which restarts his heart anytime he stops.
Okay.
So I didn't know that there was something like an external defibrillator. So I'm just seeing that now for the first time.
Okay, thank you so much for that.
So the question actually is, how do they fix the internal one? Do you have any idea? Is it through surgery?
Okay. How the internal defibrillator is mostly in surgery. It's going to be a surgical situation. And for caregivers, want me to tell you the medical, to go deep into the medical aspect. As a caregiver, our duty does not include fixing the internal defibrillator. But for the purpose of this, our duty doesn't extend to that. We only use the external one to help the person. But the internal one is actually, they used to fix it. And you know why they do? That particular person must have an internal defibrillator, someone that has the challenge of maybe has issues, cardio issues, cardiovascular issues, or maybe cardiomyopathy. I don't know, those anything that has to do with the lungs. There are some people that when you have lungs issue, you have maybe you are static, anything that's got to do with your respiratory tract and all that. You are not advised to do any except thing. But when you it can result in that situation. So that particular person that you have talked about, that is having, if I understood you, that is carrying an internal defibrillator, automated defibrillator inside him, must be a person that has a serious challenge, has a particular challenge. And it is as if I know that person, is advised that the person shouldn't do anything that are things that will involve that type of energy. Because when you do that, means that his lungs, he has issues with his. When you have issues with your lungs, blockage in your lungs, in your heart, it can easily result in failure or him having cardiac arrest. So that is it. We have this one, yes, but we as caregivers, we learn how to use the external one. We don't, the doctors that handle the internal, of course, they go through surgical procedures. We are not supposed to do that.
Yes, I understand that. I asked because there's a possibility that one, as a caregiver, might have to care for somebody using an internal one. Though everything you said about the topic is right, because they actually asked him to stop playing football, and that was the advice given to him. But I think he still wanted to play and went ahead to fix an internal one and restart the start. But in the event that we find ourselves caring for somebody using an internal one, so that's why I asked the question.
Okay. I get what you mean. What you're trying to say is, if you are a caregiver as a person that is actually on that, like you are a caregiver to a particular case, the person has this situation, what to do? Is that what you are trying to ask?
Yes, that's correct.
Okay. So very well, if you are handling that, I advise, like I said, that the caregivers will work with the team, who work on your own. So if you have a person that is actually having that internal defibrillator, then it's an area of special, your scope does not carry. You understand? So if need be, you have to work with it, because the person will carry that, the person must have been given rules and regulations. The person must have close monitoring by the doctor to tell what to do and what not to do. Maybe you'll be given a level of information as regards that is caregiving in general. But we have specialized fields, like we have medical caregiving, we have other specialized. So that could be a particular specialty that we even extra education as to how to handle such a person with an external, with an internal defibrillator. Very important. But today we are going to touch it, and if it's surgical procedure, we are not even supposed to do anything pertaining to that. It is solely the duty of the doctor to actually do that. So I don't know if that's okay. If I've answered the question.
You did justice to it.
Who asked this question, please? Because I'm trying to look at my screen. So I know those that have really been asking me questions that I'm asking me to. So I can do next time when I have caregiving things. Please, who did ask the question? Is it Mr. Kingsley?
That's correct. It's Kingsley.
Okay. All right. So let's just proceed. Quickly move. It's no other thing to do. All right. Some people, and that they say, what if I do the CPR and someone comes to play, when someone can just want and say, when I am doing CPR now, and break the rib the person, you know, especially if you're not really trained, you don't know what to do. So if I want you to understand that if the fear of you injuring a person is not as great as you in a person, there are two different things. Like some people have asked me that if I do this, if I do it too hard and I can get to the rib and break one of the rib. I've had a whole lot because of my trainings. So I want to say that at any time when there is an emergency and you have the right knowledge, spring into action. Do not care about the crash risks. Don't care about the popping sound. All you should care about the well-being of the person. So again, like I said, about the slide. Let us just quickly see. Yes, I hope the video would do for us. I want us to just watch this video. Very short.
Hi, please,
Okay,
I have a
someone's
question.
hand. Okay, please ask the question.
Okay, good morning.
Good morning.
The question I want to ask is, how do you know if a client has a primary cardiac arrest?
Okay. Okay, how do you know if a client has a cardiac arrest? Okay, looking at the symptoms. Now, heart attack, like I wanted to say before, heart attack is different from cardiac arrest. Heart attack gives you symptoms that you know, maybe person's care plan, from service plan, and from what you have already had, the person's symptom can give you some symptoms, like the person is having osteoporosis, maybe having, the person can be complaining of pain and all this. Those are symptoms that you know that this is having an attack. The cardiac arrest, I'm telling you, sincerely, cardiac arrest does not have symptoms. It doesn't have any warnings as cardiac arrest. It doesn't do warning as. So, immediately a person grabs the chest and slumps, you have to bring into action. Don't need to wait to see whether the person has heart failure or cardiac arrest, because of
Volume is out.
Can you hear?
Hello, ma.
Yes.
I have a follow-up question, ma.
Okay. So there is a sudden, like I said, there's an unexpected malfunction of electrical system in the heart. Because it stops completely. The heart sees or the pulse goes. Someone fall, hold the chest and fall. So most times when you see that, you don't need to have any other warning and do your normal ABP, which you are going to see, looking. You immediately look at the eye, see the pulse, what you bring into action. This is very important. So what I want to see that cardiac skills people than anything, because it doesn't give, most times it doesn't give signals. The heart attack gives signals. So when you continue to have heart attack, maybe chest pain, discomfort, sweating, necessarily know that it is a heart attack. If that heart attack not harm you, results you, and one day you can just slump, which is cardiac arrest. So I think, I don't know if it's okay for you.
Can you hear me, ma? Can you hear me, ma?
Yes, I can hear you. Yes. Okay was one that asked the question. Who just asked this question about cardiac arrest, please?
I wasn't the one. That was a lady. I wasn't the one.
It's me, Emotion.
Emotion, okay.
Okay, my question is, I'm really not enjoying this training because my network is terribly bad. I don't know. This is the most interesting aspect, and my network is not friendly at all. So I don't know. I want to find out. Like, you must have explained it because of your teaching and the video, because of my network. So still riding on the second person's question, the last person's question. So one of the things I read before now is that whenever you see maybe someone who maybe collapsed on the road or whatever, so that I don't know whether I'm right, that the thing you can do, the first thing is to check whether the person, you can just call the person to know whether the person is conscious or unconscious. If the person is unconscious, you can just tap the person or call, are you okay? This, and if the person could not respond, and you also check the pulse rates and the you know whether the person is breathing or not. So if could not ascertain any of this, you begin CPR immediately if you have the skills. And also concerning when you mentioned breaking the rib or whatever, I think there is also, if you are trained, there may be recommended the centimeter you can press for both adult and children so that you not cause damage while trying to resuscitate that person. I don't know whether you must have explained it, but my network is actually bad. So I'm trying to find out, when she was saying whether you have a cardiac arrest, is it okay to, when you call the person to ascertain whether the person is conscious or unconscious, for you to begin the CPR? Because knowing whether the person has that heart attack or permanent heart attack or failure, whatever, I mean, if you're not a specialist, you may not be able to ascertain that. I don't know whether you have explained how to know that, but so can we just begin CPR by trying to ascertain whether the person is conscious or if the person is unconscious? So now maybe check whether the pulse rate, and can we begin CPR immediately after that? Thank you. I don't know whether she heard me, ma. My network is bad. Did you hear me, ma? Hello?
Can you hear me? Can you hear me?
Yeah, did you hear me at all, ma?
Yes, I heard you. I heard you. I'm going to ask a question. I'm going to throw more light in that. First, I want to ask, Imutian that asked that question concerning the cardiac arrest. Did you hear my response?
I actually
Yes,
did
ma,
not.
I heard your response.
I actually did not,
So
because my network is bad. Yes, I did not.
Okay, don't worry. We'll get there. We'll get there. You get now to see what to do where there is an issue. Now, just let's watch this video. Actually, I was about to play a video for you. Then the steps you have said, Madam, is very, very correct. We are getting to it. When we have practicals, we are going to see how it is done. And in this video too, you are going to see how it is done. It's just that when you ask question before we eventually get there or get there. So let's just see how to let's see if we are together. Can we hear that? Was the volume audible?
Yes, ma'am. Yes, ma'am.
I wanted to find out.
Yes,
so you just see the step. Now, this video is to explain what Imutian asked, and it's to explain what Mrs. Okechukwu said. So just look at it and then you will understand. Let's get back to it. Okay. Thank you. So that's practically it. I don't know how many people were actually able to watch that. So you see, that has answered Tian's question as well as Madam Okay's question. So many people will think through that to see what actually happened. Please, I need response, please.
Yes, ma'am.
Yes, ma'am.
Okay, so I was able to see what's happened. Yeah.
Okay. Okay. Thank you. I'm only having the same three people answer. Juliet, are you here?
But the only thing, I think is clear enough. So
Yes, ma'am. Yeah, it's just that the line is cracking or breaking.
Oh God, God help us. God help us. Mercy. Are you able to hear anything?
Yes, I saw everything. It's perfect.
Okay, Vanessa, Christy, you're not able to join us because of network, and we both prayed together that today will be better. So, Vanessa, are you able to hear anything?
It was really breaking. I really don't think some part of
okay, so the only thing I need to also add is, I don't know whether it was part of the video, but because of the network. Can you hear me, ma?
Yes, I'm hearing you. Go ahead.
Yeah, the only thing I just want to add, I don't know whether it was because I can, maybe it's projected, but I didn't see it. I think one of the things was, in case if you're on the road and this thing occurred and someone collapsed or whatever, I think the best step before even calling the person to know whether the person is conscious is also check the safety of the environment. Is the environment safe? Because the environment is not safe, you yourself, you're not going to go and render this CPR because you may end up losing your life as well.
Okay, ma'am, don't worry. All those things are adequately taken care of. We are going to, like I told you, I like the training, BCC UK trainings. We like to make it all a competition. So that when we get to the proper practical sound, for you to see a live person, you watch it, you now see all these things you are saying that are very regular, we are 100% correct. So we will get there. I think you will see when we eventually see. Let's move and see the recovery position. We're going to learn how to put someone in a recovery position today, and then we're going to learn some acronyms. Remember mobility, how you can transport a casualty, maybe a fat person, you are one, how you'll be able to go about it. We will talk about that. We are going to see. And recovery position. So we have all good Samaritan laws that actually cover everyone. You know, from if you attempt to resuscitate a person, if you attempt to give help, you know, sometimes people away from helping all people when there is an emergency, be afraid of maybe if they actually do CPR, or they actually do what they have to do, and they lose the person or something gets worse, they'll be held responsible. No, there is what we call Samaritan law, and this good Samaritan law actually extends to anybody that does out of his or her own free will, the knowledge he or she has to be able to render service to anyone at any time. So practically, that's what we want to look at. The slide, you see the other laws act within the scope of your training, provide help voluntarily, and so on and so forth. If the victim cannot reply, you need to ask for permission. But if the victim cannot reply, then consent is implied. You just imply that the person actually needs help. The person cannot talk for himself or herself, especially in an emergency situation. So while we just see a swap, we are done with the theoretical aspects of it. We just want to, we just have a little thing, some things to do. The practical network is bad. Oh, that's so sad. There's someone I want to ask if the person is here before we move, because I know. Omojesu, please. So Omojesu, are you here? Omojesu, thank you. Okay, maybe the network is not permitted. So I pray your indulgence now to just give us a few minutes. Let's set up the technicality, the practicals. Thank you. Please don't go away. Hold on. Give us a to switch over. Thank you. Stop and ask for you. When the procedure is finished, just ask questions because we need to have questions to help us do better. So over to you, Nurse Finch.
All right, good morning. How are you? I am Nurse Finch. I am here to assist you. I've been assigned to be with you today, and I want to take care of the catheter. You love me, do that for you. It's all right. Now, as part of infection prevention and control, I am going to start by washing my hands as usual. Wash my hands thoroughly and dust. Proceed to clean my hands. And then I'm going to be putting on the examination glove. Then I will start by cleaning up the perineum with soapy water. Then I have to provide this. Madam Rose, and here, I want to clean your period. Will you have me do that? Going to be cleaning the perineal area. I have to expose only the area that I am going to work with. Madam Rose. Okay, Madam Rose, you're going to put up your leg. Sorry, ma. Here I take the soapy water, clean, stop the bottom, stop the bottom, and then rinse, clean again, rinse again, and finally you clean the anus. You clean the anus at last. Then I turn Mrs. Rose to the side so that I can clean that side well. Now I am done with the perineal area. Now I want to clean it, make it dry, top to bottom, the anus, and the now it's so clean. Are you okay? Thank you. Make my client comfortable. Then after that, I'm going to be emptying the urine. Here I come with the paper or the urinal. This is Rose. Oh, you made something today. I will pick up the urine bag. First of all, you check the quantity of urine that your client has made. Today, I noticed my client has made 2,000 ml of urine. So I'm going to be emptying this urine. Please don't allow this bag to touch the ground. And it should not be hung in a way that it would the catheter. So that is what we get urine bag. Can you see me? This is the urine.
Yes, ma'am.
Now I am going to just open the valve. There it goes. Empty the urine bag. This is supposed to make 1,000 ml urine over the night. And I'm going to document this immediately after now. Because whatever is not documented is not. Note that I'm going to document this immediately after now. All right, the urine bag is emptied. Then I will lock it back. And here I put it again in the bottle. Cover urine now. And then I take it to the toilet to discharge. Then I pack with the gloves. Wash my hands. dry my hands, then I go back to make my hands comfortable. My nose, hope you are fine. Please don't stop for me. I will be you all day. Are you okay now? Thank you. Take good care of yourself. Here is your phone. All right.
Oh,
and then I go for that procedure. Any question?
Thank you so much for that. We talked about parental care when we were having the training, and we did say that privacy is very important. Like you see what the caregiver just did, privacy is very important. But sometimes if you have to attend to your client, ensure that you give your client, make your client comfortable. Don't ever, in the course of carrying out perennial care, don't ever make your client feel less of a human being. That's very, very important. Thank you so much. Yes, if there's any question you want to ask, this is the time to ask before we get to the next procedure. Do we have any questions? Are we together, please?
Yes, ma'am, we are together.
Yes, I have a question.
Okay, who is asking the question? Please tell us your name and
Adedayo.
write them. Adedayo. Mr. Dayo,
Okay.
it's nice to have you ask the question.
Nice to, yes, okay. Concerning the job, the real life job situation now, do they post a male caregiver for a female client?
Yes.
Huh?
We have male caregivers caring for the female clients.
Do you hear me?
Okay. Yes, Mr. Adedayo.
Yes.
Mr. Adedayo, what you mean is, I understand your question, what you mean is a real life setting, can a male caregiver be assigned patients or clients? Is that what you mean?
Yes, a male caregiver, do they assign a female patient to a male caregiver?
Yes, that's very correct. A male can assign, but when it comes to perennial care, always advised of the tradition is for a female to be attached to a female. It's not the sensitive aspect. So most of the most organizations and facilities, it comes to male can maybe get the food, do other things. When it comes to perennial care, it's always a lady to a lady. It's how it's always done in the caregiving setting. So that is the perennial care is woman to woman and man to, that is the tradition. So that is Mr. Adedayo. You have been able to understand. Can you hear that?
Yes, you have answered. Reason why I asked that was because when I saw her taking care of a female, and I was like, will a male be doing this for a female? Right.
I just same thing I saw we had CPR. That I was saying that a lady once asked me what I want to do mouth resuscitation for a male. Will I be able to do? You know, so these are questions that are, but at the same time, the caregiving setting is what I'm telling you. Sometimes we have male doctors when we go higher in hierarchy. We have a lot of male doctors that actually help with delivery. You see everything there. So sometimes women too would not want to, male doctor is a male doctor, but those that have entered the labor room, you'll understand that when you get in there, when labor starts, you will not remember whether it's a male doctor or female doctor at that point. So, but when it comes to caregiving, it's always female to female and then male to male to eat certain things. And of course, also remember that these clients, these patients have their preference. Like we should always their consent. You should always make sure that they are prepared, as in they give their consent to whatever you are doing to them, and you continue to communicate, especially the perineal. You can't touch someone's sensitive part, private part with due consent and all those things. So these are some things that we really need to understand. So thank you, Mr. Dida. It's that comes believe it's actually a good question to ask. So do we have any other one? Any other question? Any other? Okay, question. So let's ride on. Let's go to the next one. Okay, on that, we finished like first section of it, and I guess you saw the vet pan too. It's important that you are.
Sorry, please. I've lost video. Tell some people to mute their microphone. I can see some people still on with their mic and they are not talking.
That's what I already said. Can we to have a history session? We have even entered the accuracy. So please, I crave your indulgence. Let's try to see how to mute our microphones. Leaving your microphones on affects the picture quality and the audio. People that are into computer technology understand what I am saying. So please, kindly mute. Even if you don't have anything to say, just mute your mic. Please, that's very important. Thank you. So I want to look at oral care. Remember, we talked about oral care. So that's the next part we are going to look at right now. So our friendship, over to you, ma'am.
Okay. Good morning, Mrs. Rose. How was night? I am a friendship here to help you, assist you to brush teeth. Are you comfortable? It's all right. I'm coming. First of all, you have to wash your hands. Very important. Hand washing. Very, very important as part of infection prevention and control. Now I'm done washing my hand. I'm going to gather all the supplies for hand washing, all the supplies for oral toiletry, that is brushing of the mouth. I have here the toothpaste, the toothbrush, the toothpaste. I have the face towel. I have the water. After that, I'll take it to the patient bed. Then I still buy price. Rose, can you do this yourself? Okay. So I have to get my slide to be in a sitting position. First of all, I will top up the bed. I will help my kid to be in a sitting position. Mrs. Rose said you can put it. Then I'll pick the brush, wet the brush. I'll apply a little of the paste, hand it over to my client, and I'll and brush your mouth. Please brush your mouth. My patient is brushing her mouth because she is conscious. And where the patient is not conscious, you will assist him or her to brush After brushing, like this my patient is just after brushing, she the water, rinse out, and pour it out into the kitchen dish. But when the patient is not conscious, either I will use the brush or I will use some sponge. That's what we call oral sponge attached to sticks. I'll brush the mouth. After brushing the mouth, I will also do the cleaning. I may not do water. I also is not taking anything by mouth. Please don't allow the client to use water so that he or she will not swallow the water. Please take note of that. Then in a home whereby there are aged people, after brushing the mouth, they should not also rinse water. Why? Because we need the flush to be into the teeth. They can only spit out the pest. They can cause them to clean the mouth after eating, after taking water. They don't need with flush. They should not use water. Therefore, Mrs. Rose, she can use water. She is conscious. Rose, are you okay? All right. Thank you. I'm coming. Then I'll return to slides. Put away what she starts, and then we'll help her clean the touch. Then I will go break down the bed. Help her to go back to her lying position. Provide comfort and provide warmth. Then I will take away this. My patient is, my client is comfortable at this point. Are you okay? Please, like I told you, I'm going to be with you today. Please let me know what you want at any point in time. All right. Have a good day.
Wow, thank you, Nurse Kinship. Dear Kendra, thank you for that particular exercise. We have seen the oral care, like she said. If the client is conscious, then we know what. But in this case, she's able to follow the due process what she has said. And do not forget to give privacy, like we have already talked about. So I don't know if there's any question for now before we proceed. Do we have any question or any contribution? Was everyone able to see it? Because I think network is favoring us now. Were we able to get?
Yes.
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 Thank God. Oh my. Just delete caregiver. Thank you. So let's move to what. Okay, so now we want to see, like we talked about in theoretical aspect, we talked about that you need skills to be able to handle these people when you pick them, vulnerable people, people that have no challenge of the other. You need skills, you need patience, you need compassion, you need empathy, able to, you were able to go through that video that I played. So this one is just buttress for this in the video, how to feed someone that needs your help as a caregiver, needs kind of skill. Displayed by kinship in the next seconds of few minutes.
All right. All right, madam. How are you? It's time to eat. And we have fried rice with salad. We have rice. We have a bangari. We have fruits. All those foods that like. So what do you like this afternoon, Mrs. Rose? You love to eat rice and stew. Wow, I love that. Please give me some minutes to bring your food. All right, thank you. Now I am going to have some ice, going to bring the food, going to bring water, everything that will be needed by Mrs. Rose. But Mrs. Rose, did you need juice?
Mrs.
All right.
I got something.
Here I come with table. Then some settings. The bed has a table. That's I'm going to just improvise with this. Okay. Wow, this is my fried rice and stew. Mrs. Are you feed yourself? Not. It's all right. Mrs. Rose, I want to sit out of bed.
Oh, sorry. Please, no screenshot, just a minute. Mr. Okay, your hand is raised. Mr. Okechukwu, do you have a question immediately?
Yes, I have a question. Yes, so I was wondering, I thought she could have asked this question before she started, before preparing for the food. But what if what her option is not among what the food available food she has? Can she ask this question before
you said she should have done what?
I thought she should have asked them. Let's say in the real world caregiving job. So I think so we need to ask before we prepare the food. We need to ask the client what he or she wants, right? Before we prepare, not
Okay.
Yeah.
Okay, ma'am. That means your network is actually affecting you. Others must have heard. She asked her, "What would you like to eat? We have fried rice. We have this. What would you like?" So she answered. So I think maybe you didn't get the network. Please, the others here, other people here.
Oh,
yes,
okay.
ma, I heard
Maybe it's
her.
my network. Sorry for my network. It's really terrible.
She asked. And they said she wanted rice and hence it was yeah. Okay, thank you.
Sorry for taking you back. It's my network wahala. Sorry for that.
So
okay. Mrs. Ross, I'm going to bring you out to the chair so that I can see you. Are you okay, Dad? Still maintaining privacy? Then going to wash my hand. Rose, can you feed yourself? Can you feed yourself? Here I go with my rice and stew for Mrs. Rose. I'm going to be feeding Mrs. Rose. Mrs. Rose, do you like aroma? I'm about to feed clients. Little by little, be patient with our clients. respect their eating habits. Please, don't rush them. You put the food in their mouth. Please, don't grab the spoon. Alternate a sip of what? Observe closely to be sure that actually shallow before you give the next one. Is it Rose? Are you okay? You enjoy the meal? Are you okay? I don't want again. Like I said before, respect their eating habits. She may not want to finish all. Just the little is okay. And this is okay that she don't want to eat again. You don't have to shout at her. That you finish preparing this and that, and your client is not eating much. At this point, she says she don't want to eat again. Take your water. Now I'm going to return clients into bed. Possibly she's going to remain in a sitting position for a minute. Sis Rose, are you okay? Some minutes, allow some minutes.
All right, thank you so much, Nurse Kinship, for that short presentation concerning the, remember, food and nutrition is very important for any vulnerable person or anybody healthy. So I'm taking into consideration that is what Mrs. Rose said. So the caregiver actually gave her what she wanted to take, aligning it with the fact that she doesn't have any serious food allergies towards that particular food. But remember, I told you that there are times someone can crave a particular food that does not align with person's health. Maybe the doctor allergies to some kinds of what like to eat, because of course you know that people that are vulnerable, people that are ill, people that are sick, some they crave for things that are not good for their health. And talk about this in the practical. I mean, I beg your pardon during the theoretical aspect. So it is very important that you take that into consideration, your client preference. But not only that, you also allow him. So if she tells you, for instance, Mrs. Rose says, I want to eat a pack of candy, or maybe I want to eat something junk food, something that is not good for her, all you need to do is to let her know the reason why she shouldn't take that. And if she insists, then you work with your care team, because the most important thing is not to take the control of a person's life from that person, to give that person preference, to give that person dignity, ensure that that person still has full control of his or own life. So very importantly, I wanted to say, we are feeding us, our dear caregivers showed us now, have to be careful, you don't rush. There are people that have what we call dysphagia, like I said when we, and those particularly have issues with swallowing things. So dysphagia is a challenge that most of these vulnerable people have. So anything that got to chew and swallow gives them tough. They have to hold their truth because they struggle to really swallow. So that's some of the things that we need to take into consideration as caregivers when we have to Thank you very much, Nurse Finchi. So now we want to, any question before we progress to the next one, the next part? Do you have any question, please? From anybody, it doesn't have to be a question. Kusan, you are here, and other professionals in the field. Is there any question or any observation? Please, are we even together?
Yes, we are together. I don't have a question.
We are together.
Okay, all right. So that's just about the aspect, which is very important. So let's go to the next aspect, transferring. Okay, now we have some people that actually maybe are the result of stroke, or maybe usually other they have either a weak left arm or a weak right arm, or have issues with setting up. So you want to see there's a clear technique that you have to look at if you want to dress a person that has a weak arm. That's the aspect you want to look at now. It's a technique, so just that you have to be very careful with the dog, with the hand. So you have to know how to get the properly, or to dress them all properly. So let's see how that goes. Thank you, Nurse.
All right. Good morning once again. I am here to help you. I'm here to assist you dressing. Will you love me do that? It's all right. Now I'm going to gather my supplies. Before I start with washing my hand. That is the principal thing as part of detection, prevention, and control. Before you start to clients, please either wash your hand with soap and water or with the use of alcohol-based sanitizer. I'm going to be changing my client clothing and help her to put on another one. So first of all, I have to provide privacy for my clients. This client of mine has problem with the right hand. She has problem with the right hand. So my now has to change the clothes. So I'm going to be starting while changing, removing the previous clothes. You start with the strong hand. While you start with the weak hand while removing. Then while putting on another one, you start with the weak hand. So while removing, you start with the strong hand. And while putting on another one, you start with the weak hand. So here I go. And close. I need to take this off you. Sorry. Provide privacy as much as you can. This is the weak hand. Sorry, madam. While dressing again, you start with the weak arm. Be gentle. Here I go.
Omo Jesus, you are causing confusion here. Mute your camera. Your microphone.
Jesus, please help us. So we could be help us,
And the strong hand will dress last. Make your client comfortable. Provide the needed warmth and make her comfortable. Mrs. Foss, I am done changing your clothes. Sorry, you'll be fine. It's all right. All right. I am done.
Okay. Thank you. That particular skill that you need to learn, learning how to dress up a client, the right hand to use when you are wearing, and the right to use in your room. Very important, because if you are not careful, stroke, people who have stroke are actually affected. So let's see, because we have to move as fast as possible. I want to see how to transfer the client or your patient. Sometimes you may need to take your patient from the bed to sit down on the chair, or remember with mobility, theoretical training earlier on. So let's see how we can transfer a person, a client, from the bed to the chair, or from the wheelchair to the bed. That's part I'm going to do now. I've taken some comments, like I like to say, I don't know, Mr. Collins is saying he's not able to see. So I don't know if he's been able to understand Mr. Collins. Hello, Mr. Collins, are you there? I've just read your comments. I guess that was 11:22. Okay, so let's move on, so we can just wrap it up as soon as possible. Please, are we still? I think network got really, I don't know from this end. But even if you have network issues from then, the rest assured that you're going to have the video recording, everything. You're not just going to lose that in any aspect. So I would like to know, are we together? Can we speak, Ellie?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
We're done in no time, and so we can leave. All right, Nurse Quincy, over to you.
Okay. Madam Rose, how are you? I'm going to be taking out of the wheelchair. You love me? All right. So as usual, I will wash my hand. Very important. First, what is needed is the wheelchair. Wheelchair is here. Bring the wheelchair close to the gate as possible. Ensure it is in good condition. Apply the brakes. Mrs. Ross, you will come down and sit on the wheelchair. Are you okay with that? I'm going to be assisting the class to first of all, I will help her to bring out her legs, then bring her to sit position. Position my patient. Her legs, two legs in between mine. In a setting where you have this a gate belt will be applied. But where we don't have a gate belt as it is now, I'm going to wrap my hands around her. Then her hands will be on my shoulder. She's not holding me. She's just putting her hands on my shoulder. I'm going to stop my hand around her back. It's going to come down. 1, 2, 3. I lift her and I put her on the wheelchair. Miss Rose is on the wheelchair. Are you okay? Now my client is on wheelchair.
Thank you so much, Spinship. Like we said, when we're talking about mobility movement, the client have to move. Take note that she said not having the hand, because like when we had the theoretical aspect, some of you can remember, we said it's not right for a client to put you on your neck, like on your neck, because if it happens like that, both of you can fall. So all the person the patient needs to do in that transfer is to hold you lightly. That's place so that person will be affected. Transfer is very important. Like we have transfer equipment, like the gate box talked about, that would have been easier. It's just that we couldn't place our ease now, right now. So it's just to use the belt, and the belt will help in conveying the process. And as you do, you are mindful of the wheelchair, you are mindful of the place, because just like a car makes you move. So you have to push, counting the brakes when you want to then take the client. And then when the client sits down, you have to release the leg to bring them up so the client can rest. As we have just nice here. I don't know if we have any question. Is there any question or any contribution?
No question.
Okay, just the soft voice. We need to see how many participants we still have, because the voice is the response is
no question.
Okay, so that means we are good to go. Transfers, and many transfer equipment, so many that we would have, that I have in the slides for you. So just go through them. Okay, what am I doing? So now, having taken back, that's taking the patient from the bed to the wheelchair. Now we are going to see how to return the patient back to bed, because this still is very important. So as a caregiver, you need to take the patient out maybe sometimes around to let him go take fresh air, go see with the front and sauna. So you need to have that particular skill, because if you don't handle it properly, it will be a big disaster for you as a caregiver to be falling in an attempt to transfer the client. You are falling with the client, it will be a very common situation. So that's why this thing is very, very important. We have a lot of resources. So if you want to go further, you want to study more, you can do research that. Thank you. So let's see how we can turn this.
All right, Rose, how are you? Hope you enjoyed the outing. All right, so we are back. I will transfer my client back to the bed. At least when she was up the bed, I was able to dress the bed and of course to do other things. And now she's going back to the bed. This is Rose. All right. To take off the backrest, rest rather, so that you release her face. The same thing applies if we were to use a gate belt. It would have been like her waist. Don't have a gate belt, so I am going to wrap my hand around her waist, lift her to a standing position, and then you turn, make her sit, and then make her lie down. Strokes. Make her comfortable again. Then you position the wheel where you can easily use it again. That's for that.
Okay, so that's transfer of a client or a patient from the bed to the wheelchair and from the wheelchair back. So that having said, I think that's the last one. We have rounded up skills that we need as a caregiver, what we can cover. With those primary skills that we have learned through what we did, the videos and through the practicals we had yesterday and today, we should be able to do those primary things, especially the activities of daily living, like feeding, like washing, like toilet issues, and on and so now we are moving to the next part. The next one to the first aid, CPR, first aid skills for caregivers. So we are going to have our CPR practicalized, and we're going to have to learn other skills as aiders. Take note that as caregivers, you cannot exceed your limit. You cannot exceed your boundaries. Like I said, there are certain things that you must not do. There are certain that lie within your jurisdiction. So it is important that as the first aider, you have to be grounded in first aid. Grounded. By grounded is because there are emergencies that will arise that you can, because you have the right knowledge. But if you don't have the right knowledge, before you call up, before you can reach out to the team, you could have done something if you actually have the right knowledge. That's why knowledge is very, very important. So I'm just going to start now to have the next part of what we are going to do. First aid and CPR. All right, so you can thank you. So we are done with no screen shift. Like I don't work alone. I work with a team of experts. Whenever we do this okay, we deliver the best. MPD management, for real, we give the best. So we have another expert to come on the face of first aid. So now have an overview of both those things that try to talk about, that when we eventually get there, that we all see it. So we are going to see it now in the next minutes. All right. So, this is Mr. Wilson going to be handling the first aid aspect of this. He is a member of the International Red Society. So for those of you, like I told you, that I am a member of the International Red Cross Society. So it's really nice having here because we are going to learn firsthand the first aid skills. So now we are going to have a little diversion. We will be hearing clients, like we say, you may be hearing casualty, because first aid is more, you talk about casualties when we are doing first aid. So over to you, Officer Wilson.
Good morning, all.
Good morning.
Can you hear me?
Yes, good morning, sir.
Good morning.
Yes, they can hear you.
Okay.
Good morning, we can hear you, sir.
I am a person, I'm willing to take on face practical, all the things that you've been ignoring. We're going to see how we can apply some of it today. Not very often to it again. We had enough of the theoretical part of it.
Can you
Now
please
we
use the
just
mic,
want to
sir?
look at. Sorry?
The mic. It's not really audible.
You can
The audible is poor.
Okay, let's do something about it. Just hold on. Okay, while we do something about it, I want to say something, because Officer Wilson is actually going to be looking at the first aid. He's just going to go to the people aspect. So let me quickly, like I like to talk, let me quickly say something about first aid. It's important for every household to have first aid materials, first aid box. I don't know, as caregivers on this platform, we should all have our first aid boxes. And in first aid boxes, like we see, we have a lot of things there. We have the bandages, we have the everything, we have the costs, we have a whole lot of things in the aid box. So it's important that you have the first aid box so that you can handle it emergencies. Maybe there's choking, if there's a situation of burns or anything that. So these are things that are actually important, that are very, very important. So first and foremost, needless to go, if you want to delve into the first aid, we know the content of the first aid box. We already know that, but want to see how to do the CPR. So let's just watch and see how it is done. Remember, like I said, we have to carry out CPR practically and have it sent to us, because a professional exam, like I said, is multiple questions, and you have to pick one or two practical aspects and showcase it and send the video, like to add up to your performance in the clinical aspect. So it is important that you watch so that you can see what to do. So back to you, officer.
All right. You're welcome once again. We want to go straight to CPR, but before then, there are principles guiding. Hello, can you hear me now?
Yes,
We
sir.
can hear you.
Okay, thank you so much. All right. So in first aid, there are principles that guide first aid. These principles are standard that are being raised and to compromise with them. If you compromise with any principle, the crash fail. Remember, in first aid, or main aim and objective in first aid is to alleviate human suffering may be found. So you will not have to do something that instead of helping to ease the pain, you have to do something that will increase the pain. So one that I want to look at this moment is the principle of CD. CD, you can say doctor, ABCD. And that leads us to the CPR proper. All right. Now, when you have any emergency, what at home, anywhere, no matter what emergency it is, very first thing that you do is to take that's the G. In doctor, ABC, D are given you in the graph C. The D stands for danger. You have to check danger for yourself, for the family, passers, and standard by. You have to make sure the environment that you're going to administer it is safe for you and others. Now, after the T, it is R. You'll be checking for response. Now, assuming that this is the casualty and this is resourcing and we use it for practical first aid trainings and CPR. Now, assuming that the casualty down, as I come in, I will check that if I have anything wrong that can be of danger to me or the casualty, or I will have to remove the danger away from the casualty. Now, I'm going to the R, which is response. Hello, can you hear me? Now, in response. Hello. Okay.
Okay.
We can hear you.
Actually trying to, yes, he was actually trying to tell you that you have to ask the person, hello, say hello, are you okay? So
Hello,
that's what it is.
are you okay? Now, the check the show if this casualty is conscious. Even when you ask hello, you answer. Now, if it does not answer, you check by shaking the shoulder. Hello, are you okay? Now, if it is not responding, that means the casualty is conscious. After not taking response, the next thing there is Doctor A, Doctor B is dangerous. The act is response. Now, let's come back to this again. When you want to check for response, you can use all the sense organs response, and there is trace covering that. There is A, V, U. The A there is for alert. As I check this casualty, if he or she is alert, you will respond to him. Now, if he is not alert, you will not respond. Another thing to check for alertness is the eye. The casualty eyes can be open, but he or she is conscious. And you see that if you use finger and try to see to touch the eye will. Eye is one of the sensitive parts of organ. Once you just go to the eye, it will blink, and that is a sign of alertness. Okay. Then the V. Right. I was trying to talk about what if
Hold on. Can you hear him? Because I lost connection at the point.
It's 07
Yeah.
has to mute his mic.
Yes.
It's interfering with the.
Someone have put on the mic. Thank you. Okay, let's go ahead, please.
Okay. So I was still on this. In view, if this casualty is conscious, it will be able to tell me what to him. But if it's unconscious, the voice will. We are now establishing some facts to help us in diagnosing the casualty. Now, after that is the P. If the casualty is conscious, he or she will be able to respond to pain. Okay. How do you do that? If you pitch the casualty, any part of the body, it will respond to that pain. Or if anything like maybe pain touches your feet, you will be able to respond to sign or the external stimuli. All right, the U there is unresponsiveness. Responsiveness means that is conscious. Okay. After getting that, the casualty is unconscious. Now we now go back. Remember we talked about here now. Okay. Now back. The casualty is really unconscious. And what level of unconsciousness is the casualty? That takes us to the A, which is the airways. Now, the airways This is how you take your hand, the finger, take it to the forehead. Now use the index finger, the first finger, and place off the chin. Then you tilt it upward. Now it will now open the airways or the windpipe here to allow free access of air to pass. Now, after opening the airway, the thing you do is check for breathing. How do we check for breathing? With your chin. You take your chin down to the nose. If the casualty is breathing, to feel the air out of the nose to the chin. And at the same time, you watch the diaphragm. You move for the up and downward movement of the chest. With that now, you establish the difficulty is breathing or not. If there is no breathing in the casualty, you still have that examination to make, nothing to check. Don't check for circulation. Okay? You check for circulation. Circulation goes hand in hand with breathing. When the heart function and stop functioning, the circulation in the body again, and the brain will stop. So for circulation, check for pulse. Best pulse. There are two pulse points in the body, pressure point in the body. We have pressure point, so we have the axis. And what we have axis are where pulse can be felt. Pulse, artery, and the pressure point, they are at the location. And the body is divided into vertical plane. We have 11 on each side of the body. When the body in a vertical plane, that means we have 11 either side. We have 22 points. This is where us can that. For first aid training, for pulse or pressure point are always popular. And the first is where we have the carotid pulse. To check the carotid pulse, you use your finger, place it on Adam's apple. You place it on Adam's apple and you slide a little, either to right or left. You can feel carotid pulse. Out there. Are we together?
Yes, sir. Yes,
okay.
Sir.
Now, all of us come to something now. I have not taken the carotid pulse on casualty here, but I want you to check it for yourself where you feel carotid pulse and make sure you feel it and give us a feedback. Just place your hands on the other sample. Then slide it.
Hold on. All right, thank you, officer. When you asked if we were together, I only heard one person respond. So one person will just need this exercise. So I would like to ask, are we together? Is everybody?
Yeah, together.
We're together,
Yes,
ma'am.
ma'am.
We're together.
The line is talking.
Okay, so please just try it. Let's stick together so that you know the easiest way for you to find out if someone's actually reading through that. If we just place your hand in that position, please. Then we need to hear that. Have you been able to do that? Feel the pulse.
Just place your hand at Adam's apple, slide a little, either to the left or the right. Then you can feel the pulse. Can we pulse? Can we all feel?
Yes.
Yes.
Okay.
Yes.
Okay. All
Right.
Thank you. Let's move.
Let's move on. Now, that is the cutting pulse with habit. Yes, on armpit here. Just check as I'm checking. Check your armpit. The another pulse you can feel here. And that's the brachial pulse. Brachial pulse. People that are fat, it might be a little bit difficult to feel it because of the nature of their body. But if you keep pressing, not pressing hard, you can feel it. Please, is there anything that cannot feel the brachial pulse? Can we feel it?
Yes. I think they can.
Yes.
Okay, okay. The next pulse that we're going to look at is the radial pulse. That one at this. Have it here on your face. You can feel it. That is the for everybody. Everyone has it. That's how to take for circulation in the body. And the final one I want to share the moment is the femoral pulse. This one is one of the most sensitive. You put it right at your pelvic. You just place your hand on the pelvic here. You can feel it. I heard a question about the gender when it comes to face aid. When it comes to face aid, you know what is called gender. Face aider, face aider. Unless on some very critical conditions, whereby a face aider can call a lady or a woman to assist him in administering food to opposite gender. But initially, you don't really look at when it comes to faith. Because this casualty is a lady and is dying of gender or whatever, I should allow her to die. Where our work as visitors is picture we alleviate human suffering. They say human suffering, is not say just suffering. Anyway is maybe found anyway. So we don't really about gender when it comes to face. That's why I'm saying this for we can see the femoral pulse. So sometimes maybe face is one touch the female casual. Even standards to shout, want to, want to react.
They don't know.
So, saving life, don't look at all that. All right, now, after that situation, that C, we now come to the D. D now is a symptom that we really want to do. And before you read the D, with all the examination we conducted, you observe the fact that casualty is unconscious. Who is unconscious casualty? Unconscious casualty is a casualty that is not breathing. The chest have stopped functioning. The heart has stopped functioning. Now, with the pulse, you check and you don't find how to establish the fact that the heartbeat has stopped. The heart is beating again, and that is a true indication of notification in the body. Now, we now go to the D, is the CPR. CPR then means cardio resuscitation. Now, to do that, now you carry casualty.
If you want come out, you know, if they're for the room, you say they get them. I say charge the 2 tab. Give them. They go dodge go.
Who is doing that? Oh, that person is obstructing.
Silva, please off your mic.
Sylvia, thank you for doing that. Please go ahead.
Okay, let's go ahead. The question is lying down here. I have come to the point of G. That D there means it is the CPR, defibrillation. Defibrillation. And you have been told about the automated defibrillator. What is a machine used to restart the heart? When the heart malfunction, there is no circulation, and the casualty is not deep. That means that the heart have malfunction, and we now have to restart the heart. To restart the heart, we have to do what we call ECC, external chest compression, accompanied with what we call breath or kiss of life or artificial ventilation or artificial respiration, or you can take mouth-to-mouth breathing. Okay, it can also be mouth to nose. It all goes the same way. After we have established that this casualty is not living, and you want to breathe for the casualty, you lay the casualty down. The first thing that you do, remember, we've talked about Dr. A.T. You have done as we don't that the area is not free for you to do to carry out your CPR. Now, what you check first, you check the object in the casualty's pocket. You remove. Now, come back, or tilt the head again to the ways. Now, in CPR, talking about consciousness, is management of airways and maintenance of circulation. Manage the airways and maintain circulation. Okay, and that implies that each time you check for pulse, you have to record the rate of pulse, and it is important too that we know the rate of pulse saturation. Okay, in an average out of like all of us here, it is from to 80, between 60, anything higher than that is abnormal, or low than that is normal. 60, 80. This, okay, it is 60 to 80. So we have to release that. So now you record the rate of pulse that you have so that it will help you in what you want to do. Now, when the airways and what to ECC, next thing that you do, always check for that breathing that come. Go back, check. As you let's eye on the diaphragm to watch the upward and downward movement of the chest. If it does come, then you go to do your CPR, your cardiopulmonary resuscitation. Now, this is we call mouth breathing. This is impressive that you use a disinfectant to the casualties and prevent you cannot touch your mouth because this is limit the risk of cross infection. And check the mouth if there is any foreign object or babies or whatever in the mouth, if there is any, to remove. So that block the airways. Your disinfectant, it spirit preferably. You now do mouth to mouth breathing. To do the mouth to breathing, pinch that nose. And you use mouth and cough mouth. You take a deep breath and you give stuff like now when you give the kiss of life, the chest will rise. And when you talk, it deflects. You allow it to deflect completely before you now give the second one. Okay, that is now. I have given 2 rescue breaths. Now I want to give chest compression. 30 external chest compression, 2 rescue breaths. Now, how do you give the external chest compression? With your 2 index finger, okay, the lowermost bone. Okay, you now run your hand to where the rib bone meets with the breastbone. Right there is the location of the sternum. It's that sternum you apply pressure for the external chest compression. Now, as it is, you bring feel of the next hand to that position. Sternum. Interlock your hand. Your back straight, close to the start body, so your back will be straight. Just like 30 external chest compressions. The standard day say that pressing for chest compression, you must go up to 4 meters deep. So here we go. Okay, I have my pity is not case control now. Now, to some people, adapting the kiss of life, the mouth-to-mouth feeding. Sorry. We have a resource mask here. Something I was telling some people and some asking some question. So what if you meet casualty that is a lady and I painted her mouth with lips, you know, and how something like this can help. This is a resuscitation mask. Okay. All you do is you place it in the mouth of a casualty. And you now you use your hand and make it nose and mouth tight. Okay. Then you now are we saying that? So you now use resuscitation mask. Another thing I want to talk about, because we have to make one things before going out. You know, religious relation have to do with aid. Sometimes, like people in the cannot before you do or you do a CPR on someone's wife, you must go and seek the of the as far as that. And God was there to you is the a male either. So always think for the consequence of the casualty is very important. Or else, where the casualty is and the thing you can do, then you have to do everything to prevent the casualty. I would get.
Yeah, let me, sorry, officer, because I don't like to talk for too long without them responding. So I want to know if they are following. That's why I'm asking. Are we together? I hope the network is favorable for us. Are we together? Do we understand? Are we following?
I'm hearing his voice, but it's not
so
too
difficult to hear. It's breaking, but we're managing with the visuals that we can see because it's so
the
hard
line
to
is
understand what
really
you're saying.
breaking.
Yes.
But the picture quality you can see. The issue is with the audio, I guess. So I was asking, I said, what is the picture quality?
The picture quality is
right?
okay. It's the audio that is not too good.
Okay, no problem. No problem. We'll try. We are set for having. Go ahead.
All right. Now we are still on CPR. What I have just demonstrated to you now is CPR and adult. What if it is child? For the child, it's the same procedure that will take the same procedure for kiss of life and the same procedure for external chest compression, but this time around, with one hand, the child. Instead of interlocking two hands, like I say, you just one hand to give external chest compression. If compression to rescue the all right. This is for a child. What if it's an infant? Okay. If it's an infant, 2 finger goes for that. Okay. That is for an infant. We have 80 external chain your 2 index fingers. For with 1 hand, and 80 for adults with 2 hands being interlocked. Please, do we have any questions?
Okay, thank you. All right, thank you. I need to find out if we are together. If everyone can hear me, please, can you hear me? Can everyone hear me?
Yes.
Yes.
Okay, I just want to, I'm really sorry. I'm really sorry about that, Madam. I've seen your message and the network.
It's
Yes,
breaking, ma'am.
yes, I and it's something we can really we've explored all the news. I think it's just now. We don't used to have this. The network is actually bad, like most of you can attest to. So practically, what we have just seen, what we have just done, is the process from the draft C. Like I know how to do best. I'm going to let you have the slides for all these things. I'm going to see the acronym at C. I'm going to see what we need for danger, response, airway, breathing, and the circulation, and then the filtration. All of it you are going to see. It is just important to take it off acronyms because you know where your professional examination, some of this are going to be there. So it's important that you understand them. We also had the APU too. That was alert, being alert, the voice, pain, then unresponsive. These acronyms that are very important. And then we also showcase. I'm happy we were able to see visuals. I think that the audio was the challenge. So, like what we saw, 30 heart compressions and 2 rescue breaths is what is applied for CPR, because you would have to do at least one skill at the end of the training. I'm going to explain the practical aspects of what you have to do. So that is how to carry out CPR. At 3 points in time, you find a casualty and someone that needs your help. You know, that's why you are a caregiver. Outside your caregiving setting, speak to action, follow the process, check all the vital signs, all the things that you need to check before you actually carry out the CPR. So for that being said, I don't know if we have any questions. We have anything to ask, because we have just a couple of them. Surely today will be done before the rest assured will be over with it. So any question from anybody or any contribution?
No question, ma'am.
Okay.
Good afternoon, ma'am. It's Sylvia. It's Sylvia. I have not been following the class because I'm not getting anything. I'm hearing what you're saying, but it's breaking seriously, so I can't really follow the class.
The same thing with me. Oh, the same thing with me. It's really terrible for me today.
Oh, Sylvia, please, what network are you using? Sylvia. Hello, Sylvia. MTN.
MTN, ma'am.
Yeah. That is MTN is the case. In the case today, it's actually there's nothing really in Nigeria, so there's really it can, but that's also very interesting. I wanted everyone to see. Nevertheless, don't be discouraged and don't feel bad. When you have to get the videos and everything across to you, won't lose out in any end at all. Someone said muted since the start of the class. And that's funny. Someone is saying muted since the start of the class. Anyone, I don't know, calling?
The same thing with me. Your network's terrible.
continue. Okay, let me ask. Anybody have anything from the beginning of the 8 up until now? Has anybody have anything?
Oh, please, let's have the clip. Thank you, ma'am.
Okay, I know. I just need to find out. I just need to find out. Did anybody get any part of this session? Like you anything from the beginning to the end? Any at all? Anybody hear anything?
Yes, some. So at least
Yes,
for the for the
got some of them.
Okay, fine. I just wanted to know because since things
not everything is
okay. So practically, that's what we have been doing. So let's progress to the next part. We'll soon be done in some few minutes. We'll be done with the session. So back to you now. No, Rose, please.
Ubong for every position.
Okay.
Right. Just like this. No. Okay. Okay. Seeing how to give a external trace compound and how to the rest. And now,
Aisha Omojesu, mute your mic.
Omojesu, you see, I said that mic unmuted, that it affects quality. Those people are into technology understand this thing. So when mic is on, you are affecting it, affecting
Aisha as well.
Please. And I'm help us. We are almost rounding up, please. Thank you. Let me even have not been made good. I don't know why.
We go on.
Yes, please go on.
All right. And I was trying to say, after the external chase completion and the rescue break, when they stop doing this, remember, you have to make this man heart to revive or restart. What do we mean by cardio? Cardio stands for the heart. Has to do with the heart. Pulmonary has to do with lungs. While resuscitation simply means bringing back to or revive. You have to revive the casualty. So, assuming that you have the CPR, like I told you, when do you stop the CPR until the casualty comes up, until the heart restarts, until you revive the casualty. If you are tired, until another air takes over from you, until the ambulance arrives, until you can say casualty to the next case a line of payment that they will call, or maybe you've taken into the hospital. That is where your system stops. Hence, while doing that, and the casualty responds, or the heart restart, because definitely, if you do it well, the heart will start. And conscious casualty become conscious again. So they are recovering the cardiac pulmonary resuscitation. What you do is put in the recovery position. And how do we put in the recovery position? Inside the casualty, you check this casualty is wearing some things. Okay, remove them. okay, and keep them in a safe place for the casualty. Like I said before, always check if there are any sharp objects in the pocket as you have to put this casualty on lateral position. Okay. Now, what you would do is always maintain the tilt the head forward to maintain the airways. Sure, the airway is always maintained. Now, the nearest hand to you, you put it in the right arm. Put the hand in that angle. You now hold the other hand and you place it on the casual jaw. After that, you go to the farthest left till his foot is flat, opposite the other foot. Then you now tilt gently to the lateral push. You have succeeded putting the casualty in the recovery. The leg must bring forth support. The casualty is now in the recovery position. You do, you go back and open the doors. Now, with this position now, if there are like liquid in mouth, it would also remember that some bodily fluid in it can obstruct the airways, like blood, even can block the airways. So we sit down, the casualty is in a recovery position. Please talk about the recovery position. Any questions?
No, sir, no question.
Let me ask them. Okay, thank God at least someone is responding. No question. So, thank you so much, officers. To put in a recovery position. It is a technique that most times you see someone is recuperating, getting better. It's always the person lays in this particular one, so that what comes whatever is coming out that must have blocked the airways out through the mouth, as we have seen. So, having done that, do we need to take the next step?
Okay. Next step, I'm using this now. Lying down. Show us some writing. Approaching a scene and we like using strategy. There is what we call a primary survey, primary assessment of casualties. And in phase it is called blueprint. Now, blueprint. Blueprint is the head to toe check of casualty, especially when the casualty is not responding to you. You sit, massage the head of the casualty gently, open casualty's mouth and check the setting of the object. You massage the body. You massage the body from head to toe. And while doing this, you notice that if you touch casualty where there is problem in his mouth, he will squeeze or squint the face. If it does any painful ache to the casualty's body, the casualty will squeeze or squint the face. That you establish what casualty have in the body. So with blueprints now, you can establish what is happening with the casualty. Okay. Now, after blueprints, I just want us to quickly, even though I have overheard in the whatever they talk about online supine and online prone. The way this casualty is left now is supine. Now, the recovery position is the lateral position, while his face and abdomen is down. That is called prone. Those little things you have to know them. The question on position and what so far before we proceed.
Okay, I think they have any questions. Do we have any? We can go back to the last one and then.
No, ma'am.
Any questions, please? Okay. Okay, so that's about different positions that you are going to see in the slide. The lateral position, the supine position, as well as the front position. So it's important we know always in the health setting. So at that point, what is the next thing to do? Yes. Now we want to talk about choking. Sometimes, like I said, emergencies can happen. You are feeding your clients, and then your clients get choked, maybe eating, and then how it used to be. And sometimes it's not properly handled. When something blocks, we just finished talking about airways. When something blocks your airways, that you are good at being on the other side of the planet. So it's important that we have this skill to learn. For instance, maybe your child has the caregiving setting, child is eating and your child with the food goes the wrong time ago. I saw something online. I saw something in the news, and some of us have seen it as well. That talked about a child that was sent to school, and maybe in the class the child was eating and the child was choked. You see, so it resulted in that child being hospitalized for a very long time. Why? Because the people in that place were not able to handle it at that point. They couldn't. If there was aider, immediately that child got choked, something would have been done about it. The right techniques would have been used, at least for a doctor or for medical practitioners to come up. So it's important that we learn this. So we want to see what we can do when there is choking. So back to you, officer.
All right. Choking here can be caused by a table manner. While someone is sitting, it can choke. Choking here by even your saliva. I don't know whether any of us have experienced that before.
Yeah.
Your own saliva.
Yeah.
Choke you. Sometimes you drink water. The water chokes you. Then how much particles of food in your gullet? If that happens, if the casualty is conscious, the first thing you do is you bend the casualty forward. You can see the way I am standing, bend the casualty forward, and you encourage the casualty to cough, cough, cough. Okay. Now, you have to give 5 back slaps. 5 back slaps. Today, I'm going to just give 5 back slaps. With that, what blocked the gullet or block the airways will come out. If you try that and the particle of food or whatever does not unblock the airways, you now give casualty what we call 5 abdominal thrust. Look at my hands. Look at my hand. I lift my hand like this, place it at the navel of the casualty. Shift the casualty down. Then I now up. Okay, with this 5 abdominal thrusts, the particle of whatever called the choking will come up. If you try both, you try the abdominal thrust, you try the 5 slaps, and it does not still work. That means this casualty can go unconscious. Imagine blocking your airways. You cannot breathe again. You go unconscious. And also remember to, in all that we do in phase A, never walk alone. Then you want to take maybe CPR or this 1, 3, 4 thing as we just done. Make sure to call for help. And who help you are calling? Either a medical practitioner or ambulance, the next line of that you have to send the outage. So that is how take for choking. If the casualty is conscious, then apply CPR. Any question, please? Next question.
No, I don't think they do.
You seem really understand the.
Yeah, no, most of them are already disabled on the platform. It's just maybe
Let's write down.
and they just
Okay, sir.
so
Thank you.
how?
Okay, let me tell us once.
So sorry. So summary, what we just finished watching, like we saw, I don't know how it's gone with other people, but we are actually looking at what to do when one chokes. Like the first thing you do is to do the slap and then the abdominal thrust to make sure that anything that's there. So that's just the way to choking in emergencies. Like he said, like Mr. Wilson said, first aid, we are not doctors, we are not nurses. So what we do is to try as much as possible to analyze the situation, control the situation before the arrival of paramedics, and to do as much as possible to ensure that the casualty still holds on to life before the arrival of the medical practitioners. Now we want to start the aspect, which is TAR. Over to you.
Okay. Someone might ask, this man is saying tile. Is it a tile to for flooring or whatever? Tile there is an upfront principle that is used when you want to do casualty movement. Transportation in phase 8, what we call the transport system in phase 8. Now, this is a casualty. And this casualty, we have to see some case study and some scenario of how to help this casualty, or how to convey the casualty, or how to carry the casualty. Now, child there is running, used in carrying a casualty, conveying casualty, helping casualties movement. Is relevant to run. You know, liver system, a simple mesh or device that is used to carry any weight is above human carrying capacity. Before you now carry any casualty or transport any casualty, you have to assess and look at the casualty. If you will be able to carry the casualty alone, hence that time of comes in. The tire in the tire there, it's there. It's a task. What task do you have to take? The task is to transport the casualty. Then the I is the individual. How is the individual? The L there is the load. How heavy is the load? Is it somebody you can carry by yourself, or you need help? Then the environment there goes along with evacuation. Evacuates. Now, for instance, casualty is skin, ankle injury, dislocation. That's what they want to assist him to walk. I will roll him up. Since this completely, he cannot use it. I will now place this on of my leg. Cross the casualty hand and assist him to move. Okay. That is one of the ways we can assist the casualty to move. Now, assuming that casualty now, sit down. Assuming that the casualty is too big for me, or it's too much for me to assist, I will now call for help. Another place that will find me.
Yeah. Thank you.
That's one of our places, Mary. Okay, now we will now. Okay, as you can see, this time around, okay, we now help him to walk. The two of us. All right. In some other cases, the casualty can fall. Yeah? The casualty cannot move at all. Then we want to casualty away. Okay. Okay. We go down. Then we carry casualties. Johnson is 2-man assist. Two-man. If you see another 2-man assist, let it go.
We have to see the
That's right.
No, I think it should be in the front. Let them see the technique.
Yeah,
so let me before Paris so that they will understand. We've done the first one assist, we've done the one assist, and now look at that particular technique. What we are showing this is all situations and scenarios that we have the plans or you have made means of movement. So you can improvise as a first aid because life is very important. So let's look at that technique, like how to interlock their hands. Two people can put their hands, carry this to convey the patient. So let's right on.
Oh. 6. Oh. All right. You know, what we are doing, as we are doing it, we are looking at who we are carrying. We are applying that time. We've seen the task, we've seen the individual, we've seen the load and government, we've evacuated. Now, it may happen that this casualty is too much for to carry the card. Is when the use of will come in. Right. No, I understood. All right. Now, if the casualty is too much for us to carry, we can now bring in